The CDC is endorsing booster shots for millions of Americans, especially older and more vulnerable adults, 6 months after they are fully vaccinated. Now, this extra dose is available to those 65 and older and those in long-term care facilities who initially received the Pfizer vaccine. It's also recommended for people 50 to 64 with underlying health problems. Now, today, the CDC director also endorsed boosters for frontline workers. Now, this back and forth messaging has left a lot of people confused. They're asking, should I get this shot or not? So our Lauren Kostick talked with an IU health expert today to get some answers for you.
The CDC's latest recommendations for the Pfizer booster have opened the door to many more Americans after original guidance only allowed specific groups.
It's the individual's responsibility to essentially attest that they have one of those conditions when they come and get their COVID vaccine. It's almost impossible to police.
Dr. Cole Beeler is an infectious disease physician at IU Health, saying there are more studies proving the boosters are needed for those 60 and older compared to younger Americans.
I just think there's a lot less data that third booster is actually necessary.
The State Department of Health announced Friday it will follow the CDC's guidance, but Dr. Beeler doesn't want everyone to think they need one.
My concern for doing vaccination is that it might be sending the wrong message to people, saying that third booster is absolutely necessary to keep you safe, where if you're an otherwise healthy 16 to 60-year-old, we know that the vaccine is still very highly effective in preventing any sort of hard endpoint like hospitalization and death.
Experts say those in long-term care facilities are the best candidates for the booster. But keep in mind, it's only for those who received Pfizer.
A lot of the original resident population was given Moderna, so those who are waiting for a Moderna booster are going to have to wait a little longer.
Only about 58% of Indiana's long-term care workers are fully vaccinated. The president of Indiana Healthcare Association says he welcomes the extra dose, but also wants to work on getting people their first dose.
And the proof is right there, right in front of our very eyes about how effective and beneficial the vaccine is.
If you are interested in getting the booster, Hoosiers can start signing up on the state's website.
Now, this booster shot is different than the third dose. It's available to those with a compromised immune system. In that case, it doesn't matter if it's Pfizer or Moderna, but be sure to talk with your doctor to learn which shot is best for you. Now, the CDC has been predicting COVID numbers would begin to fall, and that seems to be the case here in Indiana. In fact, I want to show you this chart here. Look at this dotted line. This shows the average number of cases is beginning to drop and has been for a couple of weeks now. Indiana still added more than 3,200 cases, so I mean, it's still a high number. In fact, they're as high as they were back in January, but they are dropping again. And here's another good sign on this Friday. Hospitalizations are going down. As of last night, we had about 2,300 COVID patients in the hospital. That's down about 400 people from just 10 days ago.